I'm Dr. Urvashi Bharat here, your physical therapist. Welcome to my channel. If you haven't subscribed my channel yet, please go below, press the subscribe button and the bell icon to never miss any updates. Today I'm going to explain you whether to use hot or cold pack, when to use them and when not to use them. To understand that, we need to understand three phases of injury or inflammation. The first one is the acute phase, which lasts from about 2 hours to 7 days. The second is the subacute phase, which lasts from about 6 weeks to 3 months, and then the chronic phase, which will last more than 3 months. So cold pack will help in acute inflammation or injury by reducing the blood supply to that specific area, hence delaying inflammation, and also will help in reducing the swelling in that specific area by reducing the blood flow to that area. So when do you have acute injury? It could be because of the pulled muscle, ligament sprain, or any joint which is inflamed, that is swollen, having redness and warmth in that specific area. You could also have an insect bite, bruising, or tendinitis, or it could be because of any acute sport injuries or due to delayed onset of muscle soreness. You could have soreness in your muscle or any of the body area after hiking or after exercising in that specific area. So when used a cold pack, it will help in reducing the soreness. You can use cold pack in any forms. It could be a gel form, cold compressor, and if you are using ice massage or you are using an ice cube and directly putting it over the skin, you have to be making sure that when you're using an ice cube, do not use it just the static form. That is, when you're putting the ice cube on the specific area, you have to move it in a circular fashion. Try not to just keep it directly over the skin. When you use it in a circular motion, you will help by not giving an ice burn in that specific area. And you have to make sure when you're using an ice cube for massaging, please do not use more than 5 minutes. And when you do that, you can use it for 2 to 5 times in a day. And when using a cold pack in the gel form or by putting ice cube in the towel or ice cube in the plastic or by using any frozen vegetable bag, you can use it for 10 to 15 minutes twice a day. That will help you in reducing inflammation in any of these areas, or as I mentioned, tendinitis, muscle strain, ligament sprains, or even arthritis, that is swollen joints. When to use hard pack? So hard pack will help you in subacute injuries and chronic injuries. When you have tight muscles, when you have stiff joints, when you have muscle cramps, pain, and also reduce range of motion or mobility in a specific area. So hard pack will help you in increasing the blood flow or circulation in that specific area. Hence, it will promote the healing. It will help in relaxing and soothing the muscles, hence giving less pain. Also, you can use hard pack in any form, either hot showers or heating pad like electric heating pad or just the hot packs, or you could also use damp towels, like put the towel in hot water, squeeze it, and you can apply it over the specific area where you have pain. I would say I always prefer moist heat over the dry heat. So dry heat is like the electrical heating pad which we use, and moist heat could be like hot showers, hot water baths, or you use the hot packs or towels. So when you use a dry heat, it actually takes the moisture out of your skin and leaves your skin dehydrated. And when using a moist heat, it is more relaxing and soothing to the patients. So my patients, they always ask me, do I need to use the dry heat or the moist heat? I always explain them that moist heat is always much better than the dry heat. So we already knew like what all are the indications. So when you have any of these problems like range of motion or tight muscles or stiffness or arthritis, this is where you need to use the hot packs. So now we need to understand when not to use a hot pack or a cold pack. So when you have dermatitis, that means any rash or infection or any inflammation of the skin, please do not use them. And then if you have DVT, that is deep vein thrombosis. If you have thrombosis in any of the areas, like it could be arm, your leg, please do not use heating or cold pack in that specific area. If you are insensitive to hot pack or cold pack, if you have peripheral vascular disease, which is if your blood circulation is affected in any of the body part, please do not use a heating pad or cold pack in that specific area. If you have an open wound, please do not use them as well. If your sensations are impaired, whether you have numbness or you have peripheral neuropathy, that is your nervous system has been affected, or you don't have good sensations, or if you have diabetes mellitus, because with diabetes, a lot of sensations in some of the body parts, especially hands and feet, have been affected. So when using a heating pad or cold pack, you have to be really cautious, because if it's too hot or if it's too cold, you wouldn't feel the sensations of it, and you could have a heat burn or an ice burn. Also, when there is a cognitive deficits or impairment in the cognition, the patient wouldn't be able to tell you that whether it's too hot or cold in conditions like dementia. So please do not use them. If you're using a hot pack, but the area is red, or there is warmth, or if there is a swelling in that specific area or like joint or tissue, please do not use a heating pad per se. You can use a cold pack instead. As we mentioned here, if you have these signs, you can use a cold pack, but not a heating pad. And if it's due to post-radiation, that is, if you have malignant tumor and you are on radiation treatment and you have had radiation in that specific area, or you have tumor in that specific area, please do not use a heating pad. In that case, a cold pack might help, but not a heating pad. So I've explained all the indications and contraindications with the hot pack and cold pack. But if you still have any questions with respect to any of these things which I mentioned, please do not forget to write it in the comment section. If you liked my video, please like, share and subscribe. Thanks for watching.